Away with CashNet USA.
As we head into these winter months, by all means, I'm sure you've heard the reports that the COVID-19 situation is expected to get far worse, even with the vaccines on their way. So we're going to check in this morning with Dr. Jaime Ponce. He is with CHI Memorial Metabolic and Bariatric Care. Good to see you this morning.
Good morning. Good to see you, Julie.
So for your profession, this is an exceptional worry for your patients because for reasons that most of us don't really understand, there seems to be an increased worry if you are dealing with weight issues and then you contract COVID-19. Is that right?
Yes, that's right. So this is interesting. So they have looked at all the risk factors to develop complications with a COVID-19 infection, and obesity has become a major risk factor. They've done several studies. One of those showed that if you look at more than 400,000 COVID patients admitted or seen in the hospital, just having obesity increases the chance of hospitalization 113%. And then when you look at going to the ICU and dying from the COVID-19, is higher on obese patients than the ones that were not obese.
So do we know why? Is it a clotting issue? Is that the problem?
That's a very good question. So the why. So there's several things that are happening when somebody's struggling with obesity. One is the lung capacity is decreased, meaning that a person that is obese, the lungs cannot expand as well because of the obesity, and so that pushes up into the lungs. The other thing is they already have other medical problems, like heart disease, type 2 diabetes, hypertension. But the most important one, and the blood clots is also another one. So obese patients, they do have more risk of blood clots, and then that complicates the risk of blood clots from the COVID-19 infection. But the one that is more interesting, which is that nobody has acknowledged it, is that the virus needs an entry door to the cells, and that entry door is a receptor that is called ACE2, and it just happens that the fat cells have a lot of those receptors. So when the virus gets into the body, it stores very easily into the fat cells, and when a person is suffering from obesity, they have more fat cells, so they can store more virus and they can get more sick from the virus. Those are the theories behind it.
So, okay, I had not heard that one before, and I'm sure plenty of other people watching had not heard it presented that way either. So, if you are struggling with this, time is not your friend right now, right? So I'm sure people are wanting to do what they can to get healthy pretty quickly. You're not trying to push this if you don't believe in it, but you've done some studies, and the ones who have had the bariatric surgeries seem to fare better than those who don't. Is that right?
Yes, correct. So obesity, as everybody knows, there are different options to treat obesity. They've done a study in Cleveland Clinic that was just published late last month that shows that all the patients with COVID-19 that showed to the hospital in Cleveland Clinic in Ohio, they look at the patients that had previous bariatric surgery, meaning weight loss surgery, and they compare those to the obese patients that didn't have bariatric surgery. So the obese patients had 45% chances of getting hospitalized. And the ones that had previous bariatric surgery, only 18% got hospitalized. And then, Julie, when they look at complications, this is the most interesting thing. So the obese patients had like 13% chances of going to the ICU, like 5% chance of going to the ventilator, and like 2% chance of dying. None of the patients that had bariatric surgery went to ICU, went to the vent, or none of those patients died. So it's very striking to see that people that have lost weight with bariatric surgery in a study like this, they didn't have the same complications as somebody that were still obese.
Okay, so as much as you believe in the surgery, though, you don't want to see people just rush into it uneducated.
Correct.
So in the past, you've always had these kind of lunch and learn sessions where people can come and ask questions to you. You can't do that right now, I guess, with COVID. So what are you doing in its place?
Yeah, we always want the patients to be well informed. This is not only about the surgery, it's about having all the multidisciplinary concept. We have psychology, we have dietitians, we have exercise support. And so right now we're doing virtual seminars. So if they just call our office, 899-1000, or go to the website, ChattanoogaBariatrics.com. They can register to an online seminar. They watch what is offered. and then they can decide if they're ready to take some lifestyle changes to start making those changes to improve their health.
All right, Dr. Jaime Ponce with CHI Memorial Metabolic and Bariatric Care. Thank you so much for the education this morning.
Thank you, Julie.
And you can find his office at the location there on your screen. The phone number 899-1000. Online, it's ChattanoogaBariatrics.com. We're back after this.